start this half hour with today's health headlines. A physician scientist telling us about liver cancer care here in New Haven, what your life may look like after certain liver cancer therapies, and what the future of liver cancer care will look like. Joining us, Dr. Julia Shapiro here, Yale Medicine interventionalist, radiologist, and professor at Yale School of Medicine. First of all, doctor, good morning. Thank you so much for your time today.
Good morning, and thank you for having me.
Oh, it's great to see you this morning. And as National Institutes of Health and Yale-funded physician scientist who treats patients with liver cancer with minimally invasive procedures, what can you tell us about liver cancer care at Yale?
Well, what I would start saying is that liver cancer is on the rise in the United States, and in fact, is only one of very few cancers worldwide where the incidence rates keep rising. And it is currently the third most common cause of cancer-related death worldwide. The rise is primarily caused by high rates of fatty liver disease and viral hepatitis, and in the United States, this is primarily due to hepatitis virus C. At Yale, we have a very modern multi-specialty liver cancer program with doctors from medical, surgical, and interventional oncology, such as myself, as well as dedicated liver function specialists who participate in care. And that includes surgical resection, liver transplantation, modern immunotherapies, and minimally invasive image-guided interventions that I can also offer myself.
Wow, it's concerning to hear that those numbers are rising. Anything you could tell us about the cause or anything that can help us with lifestyle changes or anything?
Yeah, well, certainly some of the causes are the rising rates in obesity in the United States. As we know, this is a prevalent epidemic, and certainly also the prevalence of hepatitis virus C, which we have been treating quite successfully in the last 10 years or so with very effective new drugs. But unfortunately, patients who have been exposed to these risk factors for the last 3 decades now come in and develop liver cancer. I think to prevent that, a healthy lifestyle is always very important, but also making sure that one is monitored regularly if one is at risk and that one undergoes regular imaging screening.
Can you tell us more about your specific therapies that are offered there and what life may look like afterward?
Yeah, with pleasure. So I'm an interventional radiologist, and I treat patients with minimally invasive image-guided procedures that are mostly done on an outpatient basis. I use advanced image guidance tools to guide tiny little instruments directly to liver tumors, and then I administer high local doses of, for example, radiation or chemotherapy, or deploy heat-based or cold-based forms of energy to locally destroy liver tumors while sparing the unaffected liver. These therapies have the benefit of being extremely well tolerated by my patients. And in many cases, we can provide total cure or at the very least substantially extend patient lives. We closely follow our patients in our clinic team, and we see patients before and after those therapies and monitor them with regular imaging. And when the cancer rises again, we treat again. These therapies afford patients a very high quality of life without having to suffer from long recoveries, much pain, or any side effects of conventional therapy. So our patients love to be treated like that because it gives them their lives back.
Wow, interesting to know what's going on there. Concerning to hear the numbers rising, but nice to hear about the therapies and that it is something that appears to be working here locally. Dr. Julia Shapiro, I want to thank you so much for your time today.